Good morning, guys and gals. How are we doing? I'm spiffed up here, looking good. Had my surgery yesterday at 1 o'clock in the afternoon. Was home by 7:30. Kind of just want to walk you through how it goes when you get there. They take you back. I had to put this lovely legging on. Then they give you some Tylenol and some things like that. They did have to put a tube down my throat during the surgery so I would breathe. So my throat's a little shaky today. I've been up walking since last night around 6 o'clock. They don't let you leave until you urinate. You're not allowed to leave the hospital. We were very close to having to get a catheter because I just could not go to the restroom. Honey, can you come in and lift my leg pump? So these leg pumps, they keep you from getting blood clots. That one needs raised up a bit. Yep. A little bit more, right there. Perfect, thank you. Okay. So Miss Sarah was with me. So tell them when they took me back, she got to come back with me for about, what, 10 minutes?
Yeah.
And what they do is they give you a medicine to kind of help ease the pain as they give you the spinal injections. They give you, it felt like 5 spinal injections, and it numbs you from the waist down. So that way the pain's not great after the surgery. I did have a good bit of pain in my rear end, but that's because they do a lot of twisting with you and everything. But the doctor did call you right after surgery, right?
Sure did.
You can turn this way a little bit. So what did the doc say when he called you?
The doctor just said that the hip was definitely bone on bone. Definitely needed to have it done, but it went fantastic, and he was in recovery.
Yep, and so once I got in recovery, I actually remember recovery this time. I don't remember it when I had my left one done. So I have to wear these stockings. They're horrible, but they're not terrible. I wear them till tomorrow afternoon. I'll be able to take my first shower. The leg pumps, like I said, they help you keep from having blood clots.
20 hours every day for 2 weeks. 20
hours a day for 2 weeks. I took them off. You can take them off up to 4 hours a day. Did not sleep much at all last night, right?
No.
They want you to drink a good bit of water to get the anesthesia and stuff out of you to reduce the swelling. So literally we would lay down and 5 minutes later we would be back up going to the bathroom, and that happened until 6 o'clock this morning.
No.
And then we finally slept from about 6:30 to 8:45 or 9. Like I say, I'm going to show them how I can walk.
Okay.
So I can basically lift that leg up. I'll show you guys. You do not want to pivot on your foot, but I can lift my leg up to about right there. Been doing some exercises. I can walk with it. Like I say, when you turn, you have to turn everything. And I can put weight on the leg now. The hip pain, there is pain from the surgery, obviously, but the pain in the hip, like when I stand up now, I can just stand up straight. I don't have any pain. I do have some low back pain because I let this go so long that it really messed my low back up a little bit. So I'll probably have that for a couple months or maybe just a couple weeks. I can put weight on the leg. I can actually walk on it. Not a lot, but I can walk on it, like I say. You can see that. So it's, we are less than 24 hours after hip replacement, and I can walk a little bit on it. Don't want to do that a lot. You want to walk with the walker for the first couple days. So the medication they've got me on is baby aspirin for 2 weeks. They have me on Celebrex for, I think, 2 weeks. I have one more antibiotic to take. My pump fell down again, honey. Can you lift that up? They also gave me oxycodone, which I'll take probably till tomorrow, just to, you know, get rid of some of the major pain that I have in it. And they gave me Tylenol as well. That's good, sweetie. Thank you. So let's see. I'm trying to think. Trying to give you guys a good barometer. The pain, like the surgical pain, is the only pain I have. I've been doing the thing that hurts the most is like when you squeeze your butt cheeks together. They make you do that the first couple days. That hurts a little bit. But I gotta tell you, man, overall, I feel so good. None of the pain in my knee. The pain in my knee is gone. The pain in my leg down low is gone. No pain in my foot. So I did want to thank a bunch of people. I wanted to thank my buddy Tom Dovey. I want to thank Ray. Ray called me today to see how I was doing. Lou Roberts, obviously. Alan Claw, I called him last night, and there was so many people that have been praying for me, and I wanted to thank you guys. And the last time I had a hip replacement on the left, I was still in the hospital at this time. It's about 11:30 in the morning. I did not get home till like 2 the next day. We were home by 7:30 last night, I think.
Oh, I think it was around 7:15.
7 or 7:15. I wasn't able to eat a lot last night. I did have an upset stomach after the surgery, but they gave me some medication that took that away. There's a lot of medicines to take like your first 24 hours. And then after that, you're down to probably like 3 medications. And then they go on for just a couple weeks, and then you're basically off of everything. I should be on only Tylenol or Advil by this Thursday at the latest. So, but yeah, I'm walking. I'm not like walking great, but like I said, it's not even been 24 hours since the surgery. You can see I'm able to bend my leg. Now, the swelling, there's a lot of swelling, so you have to ice like 20 minutes on, 20 minutes off. I can kind of show you the leg here. That is very numb, but there's my surgical scar. It goes all the way up into here. And you can see the leg is very swollen. But that's what the ice is for. The leg will swell. For the first few months, the leg is going to swell. I know when I go back to work, it'll swell up for the first couple weeks, but I just come home, put ice on it, it'll go away, and then it does it again the next day. It's just the way it is with a hip. So it was very successful. Not definitely not as painful as the last one, was it, honey? I don't think.
I don't think so.
No, so it went really well. I know my buddy Poetry Lawn Care, he just had a hip replaced last month. For some reason, hips, when you're doing lawn care, man, a hip is something that really goes bad pretty quickly if you're doing lawn care, just for the simple fact you're up and down, you're constant, like if you're mulching, I mean, the revolutions on that hip, man, is over and over and over, and it just, you know, you're moving so much when you trim yards. The fact that I do have a stand-on mower, I do know if this one is anything like the left one, the first week my leg will be very sore standing on the mower, and then once the muscles get used to it, it'll be back to normal. But I just kind of want to, you know, every day kind of update you on how we're doing. We start physical therapy this Thursday. We got a lot of stuff, a lot of pillows and stuff like that. You have to make sure you're setting on pillows a lot right after your hip surgery, the first couple of weeks, because you don't want to set at a 90. You want to be up above that. You don't want to put any, when you're standing up off of something, you don't want to put any weight on that leg until you get up. I know I look fantastic with the leg pumps and my little stockings, but man, I'll tell you what, guys, I'm so blessed that we were able to get this done in the winter time. Like I say, my low back still hurts a little bit, but all that pain I had going down my leg and everything where I thought it was sciatic, that's all gone. So I do want to thank Brandon and Terry from the Lawn Stars, because they did give me a call and said they were praying for me, and you know, just so many people, man, that I'm not going to remember, but I really love all you guys. You guys are awesome, man. And come here a second, honey. This is the lady that, I mean, this is the trooper right here, boy. She's been doing everything for me, haven't you?
I'm trying.
Tell them if your spouse has a joint replacement, it's pretty tough on the spouse.
A little bit.
Because they have to do so much for us. And I know Miss Sarah is eventually going to need a knee replacement. So that's going to be tough. And, but man, she's been a trooper. She's been awesome. So guys, hope you have a blessed day. I just wanted to let you know I'm doing well. We're going to take you through this journey all the way up to where we start doing lawn care again. Right now, I still have anesthesia in me, so I'm a little shaky and I'm a little cold, but that's slowly going away with the more water I drink and the more I'm able to urinate. So I have not been able to go to the bathroom like number 2 yet, but then again, I haven't eaten really much since 8 o'clock 2 days ago on Sunday night. So anyway, guys, hope if you're going through a hip replacement or you're getting ready to go through a joint replacement, ask me any questions you want to ask, and I hope this series of videos helps you if you've gone through it or if you're getting ready to go through it. But I wanted to let you know I can walk now without a tremendous amount of pain. There's no joint pain anymore. Most of my pain is my rear end and just right up in this thigh. But that's all because, well, they cut me open and took a joint out. So anyway, hope you guys have a blessed day. Thanks for checking on me, all those who did. And if you guys have any questions, leave them, leave comments. We're going to be doing videos every day, updating you on the progress. And hopefully by this Friday or next Monday, we will be on the cane and we can put this walker away. So I did walk with the cane yesterday, didn't I?
Yeah.
So it seems to be like, but what you have to realize is you got to let it heal. You can't just like, oh man, it feels good, so I'm gonna go do all this stuff. You can't do that. You gotta let it heal. So, guys, as always, Dr. Real's in the house. Keep it real. Sarah Cuda. Ooh, Sarah Cuda. We'll see you guys tomorrow. Peace.